right. Welcome back to Mental Health Colorado's Legislative Lunch Break webinar series, where we share biweekly updates on what's happening in health policy at the Colorado State Capitol and how you can get involved. Today is February 27th, 2026. My name is Ashley Perales, and I'm your host for the program. The Q&A option is available if you'd like to submit questions, and we'll do our best to get to them by the end of the webinar. And with that, I will pass it to Vincent and Wendy.
Thanks so much, Ashley. I'm Vincent Atchity. I'm the president and CEO.
Good afternoon, everyone. I'm Wendy Buxton Andrade, and I'm the Vice President of Government Affairs.
So I'll just get us started as we do every other week by reminding everybody of our areas of focus across the lifespan. Our advocacy work is both at the Capitol and in the communities. We work to pass laws, change practices, and build a movement for promoting healthier minds across the lifespan for all Coloradans, and then reiterate these key focus areas for the legislation that we zero in on each session. We parcel out all the bills that are introduced according to these categories, and our aim is to make sure we're doing our best to educate elected officials and voters about the complex nature of our behavioral health landscape and all of the different pieces of policy that are tied to our objectives of a healthier Colorado. So we'll start off again by mentioning our priority bill this session, which we've mentioned before. This is Senate Bill 60, Youth Athletic Coach Mental Health Education. And the aim of this bill is to ensure that coaches working with young athletes have some training in mental health so that they're better equipped to identify causes for concern and make appropriate referrals for appropriate support. An element of the bill also stipulates that there be some advisory to parents and guardians regarding possible mental health consequences for young athletes who have experienced concussion. Wendy, do you want to say anything else about this one?
Just so you know, we are getting closer to being scheduled in committee. It has been assigned to Health and Human Services in the Senate. It probably will be calendared in the next few weeks as one of our main sponsors comes back off of maternity leave. And so we did get assigned to representatives this last couple weeks, and we're excited to have them on board so they will spearhead it through the House also.
And just a reminder, on many of these bills, we have a QR code that's listed on the screen if you'd like to contact your legislator and urge them to support this bill.
And we've also been running a bunch of interesting, thought-provoking social media associated with the bill, and we always urge you to share our messaging with your networks of folks. All right, so the next one is House Bill 1024. This is raising the age of voluntary relinquishment of a child. This bill basically brings Colorado into conformity with most other states that have already extended the period for voluntary relinquishment from what's currently a 72-hour period to a 30-day period to give new parents a chance to make a well-informed determination about this. Wendy?
This bill has gone clear through the House. It has come off the floor with a 65-0 vote, which is amazing. And a lot of the House of Representatives have all signed on to this bill. It now goes over to the Senate Health and Human Services Committee, and we will be following it through there and testifying as it goes through the Senate committee. And that should be calendared in the next few weeks also.
Great. Thank you. We continue to have our eyes on House Bill 1064, which is the Youthful Offender System updates. This is a bill that comes out of the Legislative Oversight Committee concerning the treatment of persons with behavioral health disorders in the criminal and juvenile justice systems. And the main gist of this bill is to ensure that young people experiencing corrections do so in as age appropriate and trauma informed way as possible to ensure best possible outcomes so that there's not recurring justice involvement and more successful community integration after the corrections experience.
This bill, just so you know where it is, it has come out of the House committee. It's come off the House floor, 41 to 18. Now it has already gone through the Senate committee and came out of Senate committee 5-2. So it is now back to Senate floor for debate, and it should be debated here soon on the floor, and we will know where it and comes off of that. After it goes on the Senate floor, whether it passes or it fails, the bill will be, if it passes on the Senate floor, it will go to the governor's desk for signature. If it does not pass in the Senate, the bill will die.
So the next one under our category of access to housing, health care, supports, and services is House Bill 1043, Transportation Network Company Discriminatory Practices. This is an important protection of access to care for many Coloradans who rely upon transportation network companies in order to get from point A to point B to access the care, supports, and services they need. And this bill introduces important protections against discrimination so that those folks are not left stranded on the side of the road, as often happens. Wendy, you want to share a little bit more about your experience in committee with this one?
This one was definitely amazing to hear the stories of how many people have been discriminated against. 2-3 rides from Lyft, from Uber, that have come to pick them up, and because they had a service dog, they were left in pouring rain out in the middle of a parking lot with no lights. And just because they had a service dog or had a disability, a driver just drove off without them. This will make it every one of the Uber Lyfts have a policy on this, and they will have to report that monthly of anybody not having a ride. And it also has a financial barrier on it, so they could get fines. The room was packed with people with disabilities that had stories of being left. It was very heartbreaking, and so this one actually passed the House Committee 13-0, and I don't think that anybody had anything negative to say about this bill. It was very positive in the room and how much we need this bill.
Moving on to the next one.
Thank you. Also under access to housing, healthcare, supports, and services is House Bill 1115. This is prepaid wireless telecom services modifications. And basically this is an important follow-up bill to the legislation that we helped pass in 22 that created a funding pathway for supporting the 988 crisis line through a fee on most people's phone bills. There were apparently a number of different kinds of phone lines that were a loophole and not included in that fee gathering. So this bill closes that up to ensure that there is steady flow of funding for our 988 crisis services number.
Some of that funding also goes to 911. So when you're needing help out there, went through House Committee on 219, came out 10-1. It went through the House floor on February 23rd and came off the floor with a 52-10 vote with 3 excused. And so it will now move over to the Senate committee.
This is bill we're mentioning for the first time today, as the previous one. This is Senate Bill 95, measures to support victim survivors of crimes. And this bill puts in protections in place for individuals who have experienced sexual assault, making sure that the testing protocols are correct, that drugs for prophylaxis of STDs are administered in adequate supply, and a number of other protections to ensure that people are as well supported as possible in the healthcare system and other systems in the wake of that kind of an assault experience.
This bill will be heard this next Monday at the Senate Judiciary Committee. So if you're interested in testifying on this bill, it will be at 1:30. You can contact your legislator through the QR code or sign up to testify on this. And there is remote testimony, just so you know.
And we're always happy to help you draft testimony if that's something that's new, but you really care about supporting this bill. You can reach out to us, and we have toolkits and guidelines, and we even do one-on-one coaching for testimony writing. So any support you need, we are here.
Yeah, I mean, other aspects of the bill to mention that are important protections are that in the course of court proceedings, the court can allow testimony to be provided in a separate room than the courtroom for privacy protection's sake. And it also requires peace officer training to include a 2-hour training to improve peace officers' understanding of the impact of trauma on the victim survivors of crimes and what the best ways to respond are in order to not exacerbate that experience of trauma.
All right, moving on to the next bill.
All right, this one, Senate Bill 113, this requires recovery residences to obtain a BHA license. This is an important step toward consumer protections to make sure that individuals who are living in recovery residences are protected by the same sets of standards around their environment across the state and not subject to variations that may lead to adverse circumstances in those settings. Gwen, do you want to say a little bit more about that?
This is a follow-up bill from Senate Bill 24-048 to help the Behavioral Health Administration regulate violations that are currently happening. And this will actually make those facilities get certified under the Behavioral Health Administration. Therefore, when violations happen in those houses, the Behavioral Health Administration actually has a way to flag licenses or pull licenses from these facilities when they are not operating under a standard protocol. So this is definitely a bill to help people that are using these recovery services so that there's an oversight over them. And this does go to hearing this next Wednesday, the March 4th, and it will be at the Senate Health and Human Services. So if anybody wants to testify for this, let us know. Mental Health Colorado will be there and as someone to testify in support of this bill.
Thank you. When it comes to supporting the wellness and Coloradans' wellness and aging, we've mentioned this one before. This is House Bill 1110 about vulnerable adult financial exploitation banking, and this creates um, protections for individuals who may be victims of scams and frauds, uh, allowing banks and credit unions to put a variety of barriers in place for withdrawals, and to inform local law enforcement when there is suspected fraud, so that there's some additional layers of protection in place for folks when it comes to that kind of unfortunately more common than we would like.
Supportive of the bill. They just want to make sure that the amendments that were promised that will be attached to this bill on the House floor were followed through with. And they would be in support as long as those amendments come through, and will be probably a yes vote on the floor of the House. So this had a ton of support. And lots of people had lots of stories of relatives, neighbors, themselves even being, exploited by some of these scams.
All right, thank you. Next one.
Yeah, so this may be the last one on our list, and this is in our focus area of reducing potential harm from drugs and alcohol, and that's Senate Bill 6, which is parity for non-opioid pain management drugs. It's our understanding that non-opioid pain management drugs are effective in managing pain in many, if not most cases, and may be preferable insofar as they do not expose the user to the risks of addiction associated with the opioids. And this bill requires health insurance carriers that provide prescription drug benefits to meet the costs of non-opioid pain management drugs on par with the way that they cover costs for the opioids. And the idea here is that we will help folks find a safer, more healthful choice for their pain management without incurring any additional cost.
This is scheduled for Senate Health and Human Services Committee on March 12th at 1:30. This bill goes along with what we're hearing in the news and everything else on opioid use and reducing the risk of opioid addictions through alternative pain management. So we will be there on March 12th to see how that bill goes through.
All right.
Yeah, let me just interrupt you real quick, Ashley. Just a couple of other items, news items that I don't think we remembered to mention last time around. But as many of you may already know, change is the only constant, and one of the latest changes in our behavioral health landscape is the commissioner of the Behavioral Health Administration, Danette Smith, stepped down from her role. And so that's an important change, and we do not yet know what the implications of that are for the ongoing implementation of the Behavioral Health Administration. We will have our eyes out and we'll keep you informed. And then the other news item that we didn't mention last week is that one of our great mental health champions at the state capitol, Senator Daphna Michelson-Jeannet, has stepped down from her role as senator and taken a new position as the director of the David Merage Foundation for Combating Anti-Semitism, which is a great move for her. But unfortunate loss for us at the Capitol. She has been a great champion for many years. We do know somebody has been appointed to that senator position. Is that right, Wendy?
Yeah, she was appointed last night. She has a background as a House of Representative and a prior years. Her name's uh, Adriana Benavides, and I could be messing up her name,
Yeah.
but she actually was on the floor today.
Adrian, I think Adrian Benavides. Yeah.
And so we were excited to meet her and start working with her and getting her to be a mental health champion also.
That's right. All right. Thank you. Thanks, Ashley.
Yeah. Okay, so I'm going to minimize it just to make sure you can see these QRs. So our lead event is next Wednesday, March 4th. If you haven't registered and you'd like to attend, you can scan that QR and get registered to attend that event. And then in partnership with the AFSB Colorado, NAMI Colorado, and SPC, we are hosting Colorado Suicide Prevention Advocacy Day at the Capitol. That's on March 19th. So there's the QR as well to register for that event. And then if you haven't yet, please join our Brainwave. You'll get action alerts, policy updates, and advocacy opportunities throughout session and throughout the year. We also have our legislation listed on our website. We will be launching a brand new version of our website that's fully accessible on Saturday, or tomorrow, yeah. So these QR codes will work today, but I will send new QR codes in the follow-up email so that you can still access these pages just on our new site. And follow us on social media with that last QR and share updates on the legislative session and information that we share on our socials. And that is all from us. If you have any questions, please email at aparalis@mentalhealthcolorado.org. Thank you so very much to our sponsors, Accessitree, Rocky Mountain Health Plans, and Johnson & Johnson for supporting this webinar. And thank you all for joining us today. We'll see you in 2 weeks.
Thank you, everyone.